Hello, Dr. David Weintritt, breast cancer surgeon. Let's talk about an overview for breast cancer treatment plan. Now, we'll dig deeper into topics such as surgical options, medical options, etc. But I think it's very helpful for patients with a new diagnosis to have a sense of what elements of risk exist and how a treatment plan would be appropriately created for their diagnosis. Initially, when someone is facing the need for treatment for a new diagnosis of breast cancer, it's very important for patients to understand that we have two elements of risk that need to be addressed. There's local risk and systemic risk. Local risk tends to be fairly straightforward. That would be the assessment of where is the cancer, how extensive is it, and what version of surgery are we going to determine would be the best, not only for treatment of the cancer, but obviously for patient being satisfied with their outcome. Systemic risk is very different and separate from local risk. Systemic risk is defined as what is the chance that the breast cancer could spread to some other part of the body. The treatment of these is typically separated into surgery and radiation, primarily for local risk, and medical treatment for systemic risk. Different cancers will have a different risk of local recurrence or a different need relative to extent of surgery. And similarly, a cancer that might be very well suited for an outpatient operation such as a lumpectomy could have enough risk that requires systemic therapy, including the need for chemotherapy. So when you are trying to have a conversation with your specialist about a diagnosis of breast cancer, make sure that you have a moment to discuss during your treatment plan what is your local risk and what are the appropriate local treatment options, and what is the systemic risk and what specific treatments will be tailored for that as well.